we know that the #1 contributor to premature death in our country is our diet. Shouldn't that be a primary lesson that we receive in medical school? When the diagnosis came, I thought it was the worst day of my life because it changed everything. And there was so much pain and suffering that followed. But I think now, retrospectively, it was a gift. It really was the best thing, the best day of my life in many ways, in that it served to put me on this path and to arrive at really my purpose.
Welcome everyone to Longevity Advantage. On our show today is the esteemed Dr. Saray Stancic. Saray Stancic is a triple board certified doctor in internal medicine, infectious disease, and lifestyle medicine. She graduated from New Jersey Medical School in 1993 after completing her fellowship and accepted a position as chief of infectious diseases at Hudson Valley VA in New York. Since 2012, she's dedicated her time to the field of lifestyle medicine. Dr. Stancic's interest in lifestyle medicine is rooted in her personal story as a patient living with multiple sclerosis. She's founder of one of the first lifestyle medicine practices in the county and mentors at Rutgers, New Jersey Medical School. Saray seeks to spread the power of preventive medicine on a global scale and bring change to how we train physicians. May 2020 saw the global release of Code Blue, the documentary film, which Dr. Stancic produced, and a recent book, What's Missing from Medicine, was released in January of 2021. Saray, welcome to the program. Great to have you.
Thank you so much, Scott. It's a great pleasure to join you this morning.
We get to have some pretty amazing people here, and you are one of them for sure. So thank you. So what I would say about your book, the reaction from my medical colleagues is excitement. Just by the title alone, there's a bit of a relief around that we're going to talk about that a little bit this morning, because I think there's been a sense both in the community and certainly in the public that there's been this slow erosion of the care system. And it's really about putting power back in the hands of patients and their physicians, which is desperately needed. So you were already a board certified physician in internal medicine and infectious disease. And as the classic overachiever, apparently that wasn't enough. So if you could take me back to October 11th, 1995, let's start there, and then we'll kind of get people rooted in what's with all of these certifications that caused you to land where you are today.
All right. So October 11th, 1995, a very important day in my life. At the time, I was a third-year medical resident, and I was on call, a 24-hour call, as we do during our residency. But this night was unique in that it was, yes, it was very busy, and I was running around the hospital, fatigued, deeply fatigued, and I found an opportunity to finally take a nap around 3 o'clock in the morning. The minute my head hit that pillow, I was gone. And as you might imagine, in the midst of that busy call, I was paged probably about a half an hour later. And when I tried to get up out of that sleeping position, I couldn't feel my legs. And it was just that abrupt, that acute. Next thing I knew, I was in the ER undergoing an MRI of my brain and spinal cord. And those studies confirmed a diagnosis of multiple sclerosis at the age of 28. And everything changed, Scott, in that split moment. I was no longer that young, healthy physician that had walked through the hospital doors earlier that morning, now a chronic illness patient. So the course of my life changed in that instant, in that the following years were very, very difficult. I grew to become dependent on a cane. I walked around with a pill box, dependent on more than a dozen medications. And despite my compliance, with the regimen that I was being prescribed by my physicians, my disease progressed. And then by chance, I came across an article in 2003 that discussed the connection between diet and multiple sclerosis. And I was sort of struck by this because of course, in all of my training, 10 years of training, I had never had a mentor, educator, or professor ever connecting those two dots. And so as I read this literature, and it led me to work published by Roy Swank, first article published in 1952 in the New England Journal of Medicine, which talked about the incidence of multiple sclerosis in Norway. And Dr. Swank at the time hypothesized that saturated fat consumption was playing a role in the pathogenesis of multiple sclerosis. These were all, new themes for me. And so this certainly catalyzed an interest in wanting to learn more and sort of delving into the literature to really understand these connections that regrettably, here I was, a dual board certified attending physician, knew nothing about. And my physicians who were experts in the field of MS, when I turned to them with this literature in hand, they looked at me almost perplexed and wondered why I would even consider this as a possible option to better manage my disease. But you know what, Scott, I was so amazed that it wasn't just Swank, that was the beginning, but there was so much literature that spoke to this. And at some point, I decided, and I didn't make this decision lightly, it was really well thought out. At some point, I decided that I needed to create some change in my own management plan, how I was going to best approach this disease. And it wasn't, of course, just my diet. It was so many other aspects like exercise and stress and learning how to sleep effectively. And as I introduced all of these modifications into my life, I started to feel better. And it didn't happen in a week or in a month, but it happened over an extended period of time. But I could tell that something was happening in the right direction. And so, long story short, Scott, I went from a young woman dependent on a cane, a diaper, and a pillbox to 7 years later crossing the finish line at a marathon, disability-free and medication-free. And today, I just celebrated October 11th, 2020, which was 25 years since that diagnosis. And on that day, I walked 25 miles with family and friends. And today, I am medication-free and disability-free. And that is certainly part of what fuels my passion to deliver this message to whomever is willing to hear it. So I'm so grateful to you for the opportunity to talk to you and to reach your audience, because I think this is incredibly powerful. It is a simple message, and it's something that we can all partake in. And of course, it's not just my personal story that fuels this passion. It's my professional experience as a physician practicing over 27 years and seeing so much pain and suffering that I now know is largely preventable. So that's why I made the film, why I wrote the book, because it is my hope that these are just vehicles by which I can disseminate the message.
Yeah, in the space of aging, we really look at it through the whole lifespan, right? It's not, when you say aging, people think, oh, we're talking about geriatrics. No, that's one small slice of aging. It starts very young, and I've say in my own experiences, the earlier an event happens, like it happened young enough to you that you had a whole life ahead of you, and you had the training background to be able to do something with it, and you were not going to roll over. Obviously, you're a very strong person, right? And you were using those skills and redirecting them in a way that you hadn't planned, and look what happens out of it. You've discovered your purpose.
Yes.
Again, people go through life and never discover that either, and that's so. These things can be gifts if we accept them as gifts, right? And I think that's part of the beautiful essence of why you've been able to do what you do, is you decided it was a gift that you were given.
I couldn't agree more. I can tell you, and I think of this often. At the time when the diagnosis came, I thought it was the worst day of my life because it changed everything. And there was so much pain and suffering that followed. But I think now, retrospectively, it was a gift. It really was the best thing, the best day of my life in many ways, and that it served to put me on this path and to arrive at really my purpose.
Yeah. So if just so we're clear with folks, MS is an autoimmune disease, right? And so even though you're talking about MS, that's really just how your body responded right?
Exactly.
Right. So maybe let's just kind of go into that so that we realize you're not just talking about MS patients here. Who,
No,
who
this is
all would you put in the same group you just that would
well,
fit
this is
with your experience?
right. I mean, I think this is applicable to all chronic disease, right? Because at the end of the day, what fuels the evolution of all of these chronic diseases is this inflammatory process, that, right? This is the basic unit that sort of results in the chronic disease state. Now, it is, of course, our genes that will predict what disease will evolve. If we have a predisposition to heart disease, then if you're living in a pro-inflammatory environment where you're consuming a poor diet and you're sedentary and you're highly stressed and you're not sleeping, when you're engaging in bad behaviors, then that's what will flourish or present itself in that individual. But the bottom line is that it's our lifestyle choices that sort of turn these genes on, right? And that's the science of epigenetics, which is something that, again, was not discussed when I was in medical school. I mean, we were told that if you have genes for diabetes and you have genes for heart disease, then you're going to get that disease almost indefinitely. But what I've learned, of course, is that so much is dependent on our behaviors, right? So we have these genes that we can turn on or off. And that's essentially what the science of epigenetics tells us, that the decisions that we make each day are so critically important in regards to whether that disease is expressed. That's the difference between genotype and phenotype. And so that is extraordinarily powerful message because it puts us in control. So certainly genes play a role, but don't let anyone tell you otherwise, that your lifestyle is what matters most.
Right, because we could line up 25 people who all live the exact same lifestyle and all exhibit 25 different disease states as a result, right?
Exactly.
Right. So that's the common thing here is autoimmune disease shows up all sorts of places. The common theme around it, the common root cause is really lifestyle. And it's part of the whole movement. So that plays nicely into what I want to talk a little bit about is part of your book is really talking about the gap in what we have as medical care today. And that's clearly what lifestyle medicine is about. But tell us, as a lifestyle medicine physician, where you saw the gap and where you think lifestyle medicine really fits into that.
Right. Well, in experience in medical school, we don't learn anything about, there's no emphasis placed on prevention. There's no emphasis, we don't learn anything, or what we do learn is really just the biochemistry or vitamin deficiencies. Whatever they call nutrition is really not applicable to patient care. So there's very little emphasis placed on prevention. There's very little value placed on it. So the medical school experience is really based on pathogenesis. So we learn the disease state. That's what we become experts at. So I tell medical students, we become really good disease detectives, right? We take thorough histories and physical exams, and then we order blood tests and imaging studies, all in an effort to collect clues to finally make that diagnosis. And once we have the diagnosis, we create a treatment plan. And the treatment plan, of course, includes what? A pharmaceutical agent, a surgical intervention, or a procedure of some sort. And all of that, Scott, is, of course, very, very important. We do need to understand thoroughly the disease state and how to manage it. But what we don't learn in medical school is the mirror image of pathogenesis, which is what we call salutogenesis. And salutogenesis is the study of health and well-being. How do we maintain health and wellness? We don't learn that in medical school. It's extraordinary to me. So I'm very I use a lot of imagery, and for me, if you think about medical school as a puzzle, and we get all these little puzzle pieces, and I think about my experience, like here's my physiology, pharmacology, and every course that I took, or every patient that I encountered, or every mentor that I had offered me another piece to this puzzle. And throughout these 10 years, I'm putting them together, but there are all these missing gaps. at the end of the day, because I didn't learn anything about nutrition. I didn't learn anything about prevention. And in fact, I took a preventive medicine class in medical school as a first year, but you know what that was all about? It was about really secondary prevention, colonoscopy, mammography, PSAs. All of those things are important, but that's not true prevention. True prevention, primary prevention, is avoiding the disease altogether. Secondary prevention, or what medical schools refer to as preventive medicine, is early detection. That's very different. So it's remarkable to me that medical school ignores this entire aspect that is such an incredibly important therapeutic intervention. We know that the number one contributor to premature death in our country is our diet. Shouldn't that be a primary lesson that we receive in medical school? And it's not, and it needs to change. The good news is that awareness is coming. More and more physicians are becoming aware of these connections and understanding that they need to bring it to their practice, and that we need to start modifying the way we deliver these curricula in medical schools. There are, if you've had a chance to see Code Blue in the film, we do feature a medical school, the University of South Carolina in Greenville. This is a medical school that is about, I think, 7 years old now. And they built this medical school on this foundation of lifestyle medicine, preventive medicine, very progressive, forward-thinking staff there, led by Jennifer Trilk and the dean there. His name is Dean Yuki, who really wanted to create a medical school that brought these principles of lifestyle medicine to the forefront. So one of the things that Dr. Trilk does day one when medical students come in is she teaches them, you must be your first patient. And that's another important lesson, that we need to know how to take care of ourselves. We need to be an example for our community. And it's really important that what we relate to our patients, what we practice in our clinics, that we personally reflect those very same principles, because I think that's important.
Yeah, boy, that
Laughing.
my wife and I, yeah, we run into this all the time around. It's very hard to accept advice from someone who clearly doesn't follow that practice themselves, right? And yeah, I'm sure we both have colleagues that we wish had made different choices earlier on, because the later we leave it, obviously the harder it gets.
Yes.
But yeah, it's that do as I say, not as I do. But yeah,
Exactly.
It really does make a difference. And if we look at the classic kind of allopathic system that's set up all around it, right? Alluded to this a little bit at the start, is it has just continually migrated to the point of it's really primarily now about corporate interest, right? And it's not that they're corporate villains, that everyone runs a business, you run a practice, like we all want our businesses to be successful. So there's nothing wrong with that. But unfortunately, in the course of direction here, I would say within the public, we probably feel more dependent on pharmaceutical solutions than we ever did. We're surrounded by it in terms of advertising. We typically, we'll reach out because we want a prescription for something.
Yes.
That's what we're looking for. And so, it has been it's been feeding itself to the point of a disease state now amongst the public, which is truly at proportions we've never known, and hopefully we'll never know again in history. But so as we think about, I look at a lot of things if you step back in time, say the pendulum swings, right? It's always moving one way or the other. We don't know if we're at the edge of public health, or if we still got to get even worse. So maybe if you can give us your sense of what your view of the state of public health is in America today. And yes, it follows a pattern in other worlds, but I think it's a good look into, if you're sitting in another country saying, well, the US is worse than me. Well, guess what? You're trending towards exactly what we've been living. So maybe you can give us a gauge across what does this really mean from public health?
Yeah, from a public health perspective, I think we're in a bit of trouble, Scott. I hate to be negative on this, but if I were to give it a grade, I think would be somewhere about a D. Um, the state of affairs, as I see it, when you look at just everyday data, I'll give you an example. When you look at obesity rates in our country, when I started writing the book in the summer of 2019, I was writing the section on obesity. And at the time, the CDC, I was just, going and looking at the CDC and at the obesity rates at the time. It was 39.8%, the obesity rate. This fall, as I was checking my facts before the book went to print, again, I revisited the CDC, and the obesity rates had climbed to 42.4%. Scott, in 1 year, our obesity rates climbed by 2.4%, which is shocking. Diabetes rates in our country climbing extraordinarily. When I was a medical student, rates about 2%. Today, we're brushing past 10%. And the CDC predicts that by 2050, we'll be at more than 30% of Americans will be living with diabetes. So we are traveling in the wrong direction. And it seems like just when you think it's going to plateau, we see another climb. And I think it's largely because the public health measures are failing. We're not conveying these messages effectively to our communities. And the investment is primarily, as you said, in the solution being the pharmaceutical industry. Of course, let me say this. It's not that I'm against pharmaceuticals. There's an important role. I mean, I'm an infectious disease physician.
Sure.
Where would we be? I mean, I can tell you, when I pursued the field of infectious diseases as a young medical student, when I went on to do my residency, I lived through the HIV AIDS epidemic, and we had in Newark, New Jersey, where I went to medical school, 2 wards of AIDS patients that were dying. And I cared for those individuals. At the time, we had no antiretrovirals in the late 80s, early 90s. And just in the course of my career, what we've been able to accomplish in that field, HIV is now a disease that we primarily manage as a chronic disease. At one point, it was a death sentence. So, and even in the field of hepatitis C, where I've done a lot of work, when I was a young attending, cure rates somewhere around 6%. Now we're at 90%. So, I mean, the development of these medications is an extraordinary accomplishment. And even in today, we're living in the midst of this pandemic. We've developed how many vaccines in less than a year? So I think the ingenuity and the advancement in the field of medicine is extraordinary. But with all of that said, so much of what we're witnessing today, and as I said, this has been published, food, our dietary choices are the leading contributor to premature death. And so these are public health messages that need to be conveyed effectively. And we need to invest in that process. And we have not. And so from my perspective, we have failed our community in that so much of this is largely preventable. We need to bring together representatives and put them all in one room and talk about how we're going to solve this problem, because the path that we're on today is deleterious, and we cannot arrive at a point where 30% of Americans are diabetic. It's unsustainable. We can't afford it. So developing yet another target, another drug to treat diabetes is not the solution to our problem.
Right. It's another Band-Aid, which if we look at the medical system, it's great at Band-Aids. I tell this to people in my classes all the time, is the medical system is not there to make you well. Right? They're there to treat conditions.
Yes.
But if you're taking medications all the time, you become numb to it, right? It's very hard to gauge. And I think that's one of the things that happens is we lose perspective of what is health.
Such a good point. I couldn't agree more. We are, of course, in this past year living through this difficult time with the pandemic, but think about for a moment that in June of this year, the CDC published data in the morbidity and mortality report that spoke to sort of an intersection of how this chronic disease epidemic and this acute infectious contagion sort of intersected. We learned that those amongst us who are living with a chronic disease and then get infected with COVID-19, you're 6 times more likely to be hospitalized and 12 times more likely to die. That is really quite a statement in light of the fact that 50%, more than 50% of Americans are living with at least one chronic disease. So we, in fact, are a country that is poorly equipped to battle this acute infectious contagion, and we've seen so much morbidity and mortality as a consequence. So it is my hope, and I talk about this in the book, that possibly might the silver lining of this pandemic be that it brings some level of interest or awareness that we really need to create a shift in paradigm, that something needs to, in the field of medicine, we need to awaken and to this this all important truth that our lifestyle choices are leading to premature death and so much unnecessary pain and suffering.
Right, and so a couple of statistics we can think about. Well, the one I follow and look to is life expectancy. So if you look at life expectancy, it's essentially plateaued in the US since 2010. It hasn't plateaued around the world, it plateaued in the US. What's going on in the US that's causing it? Because we look at countries like Japan, particularly, who I think their life expectancy is now almost 8 years beyond what ours is. And then the other statistic, which goes unfortunately against us, is the age of early onset age-related diseases, right? So people are showing up in your offices or doctors' offices younger and younger, what we classically called age-related diseases.
Yes, yes.
Right? Yeah.
And that's, you know, as a practicing infectious disease physician at the VA, you know, one of my last stops at the end of the day was the nursing home consults. And here's where I would see these patients, you know, with the infected diabetic ulcers or the pressure ulcers, the Foley catheter, UTI infections, and I would be asked to see these patients to offer input on their management. And I would see these 72-year-olds or 75-year-olds, relatively young people, demented and unable to communicate with me. And that's that, regrettably, in my experience in our country, we see this like bookend of suffering at the end of life. That is, again, so unnecessary, because so much of what brings individuals to these settings is largely preventable. But the question is, are we conveying those messages effectively? So I say this all the time. I wrote about this in my book. It is my hope that we all age gracefully, right? And then on that last day, be it at age 92 or 102, that we're able to enjoy that last day on planet Earth with family and friends, clear of mind, and then go to bed and pass peacefully. That we do not have to have that, you know, 6-month or 2-year bookend of suffering. It should not have to be. And it almost feels like in some ways that it's been normalized, like it's expected, like we should all have to go through that nursing home suffering experience. And that's unacceptable to me.
Yeah, it's so as you describe what we would like to think end of life can be, and that's exactly what I talk to people. And first class is always, how long would you like to live? And the answer is always, as long as I'm healthy. And so we describe it. If you would like that experience, as you described so beautifully, you have to make choices, right? It's not simply about luck, and it's not normal. It was more normal when more of us died younger, but you know, living to 100 isn't new, right? People have been living to 100 since you know, in times of BC. Fewer people, because we thankfully have a much better system now to reduce the risk of things that catch us along the way. But the human body is the same body, you know, that you and I had, were we born 2,000 or 4,000 years ago. It hasn't changed ostensibly since then. So I totally forget where I was going with the other point, but if we think about, let's kind of make the positive side of this is we know what's possible. Right?
Yes.
These are not just crazy dreams that you and I are talking about of kind of what life and what aging can look like. And so I'll use one example. I did an analysis of blue zones response to COVID. So guess what, in terms of, so the number one risk factor associated with COVID was age, right? So you think the oldest communities should have the most devastating results. Well, guess what? The oldest communities in the world are blue zones. So go to not just the island of Sardinia in Italy, but the state of within which the blue zone folks there live. Crazy low mortality numbers. Go to Loma Linda, California, within San Bernardino County. Compare them to their peers in San Bernardino County. Compare them to the city of LA, who has the same demographic in terms of numbers of people over 65. And you look at Loma Linda is so much lower. Is it because of their faith? Seventh-day Adventist? It promotes choices, but I think it's primarily about the choices that they make. So it's very possible. And in your book, you talked about an example, I think, between Colorado and Mississippi, just as kind of big groups of people where we can compare states. Maybe you can just give us an example of how that connects.
You're familiar with the CDC's behavioral risk factor surveillance system, which has been collecting obesity data since 1985. And that's what I referred to earlier during our conversation. We know that, for example, Mississippi has one of the highest rates of obesity and Colorado has one of the lowest rates. And in the book, I write about you're looking at the same data, but instead of looking at obesity, you're looking at exercise, what percent of the community actually engages in the physical activity guidelines, which the physical activity guidelines are at least 150 minutes of moderate physical activity per week and 2 sessions of muscle strengthening exercises. And Colorado has the highest. So the point I was making there is that the more we exercise, the less obesity, right? So, I use in the book this analogy of a wheel when I describe lifestyle medicine, right? So some people use pillars. I like to use the wheel because I like how I use the spokes to define each one of the aspects of lifestyle, which are diet, exercise, stress, sleep, addressing substance abuse issues, and then social interconnectedness. The reason I like the wheel is because I think in large part they're sort of interdependent on one another. So for example, if we're really good at exercising, we're going to be better sleepers. Or if we eat healthier, we're more likely to exercise. They sort of intersect and work together really, really nicely. And of course, if we have all of our spokes intact and working well, then our wheel is going to move forward much more effectively. I think so many of us are really good at maybe 1 or 2 spokes. Like I have really good patients who are so good with their diet, but they're not very good with their exercise. Or I have exercise, fanatics, but their diet is not so good. I have this one patient who, runs probably, 50 miles a week, but then eats cheeseburgers after his run. So helping him to understand that how he's fueling is playing a role in his overall health and well-being. And again, the other aspects of lifestyle medicine sometimes get very little attention. People don't really think too much about how their sleep patterns affect their health outcomes. And so hopefully this attention to the other spokes, and throughout the book, I keep saying each one is just as important as the other. I get it that, we're talking about food, but please don't under or de-emphasize the importance of how you're sleeping or how you're interpreting the stress that is in your environment. And this has been a very stressful year. In that we've been dealing with the pandemic, and there have been a lot of socio-political issues that have arisen this past year. It's been a challenging year for all of us. And it's important for us to understand that how we interpret that stress is playing a role in our personal health. And it certainly stirs up and plays a role in what we talked about earlier, this idea of turning genes on and off, and in epigenetics. And social connectedness has been largely affected this year as well, because we have been isolated. And so ideally it would be wonderful to have this interview in person with you, but we're doing everything through Zoom. And so it's great that we're having these conversations, but as as human human beings, it's important for us to also have these intimate connections in person, um, experiences, because they're so incredibly valuable. So a very difficult period for us, and hopefully when we move beyond this pandemic, we're going to approach this new year with a level of excitement and an appreciation for our health and what we can do as individuals to assure that we do a little better each day to put us on that path to age gracefully, and hopefully have that wonderful end of life experience where we don't have to experience that pain and suffering at the end.
Yeah, as we think about, I think, lifestyle medicine, and we view it as the journey. So it's not
Yes.
about quick fixes, right?
Right.
Which is not about popping pills. It's really about the things you do. And you must have had this too, where I get students who come back to me a year later, something out of the blue, and they said, "You won't believe how much we've changed our life, having now known what's behind it," right? That
Yes.
like the information, and anyone interested in proactive longevity is generally well educated. Right?
Yes.
That's a very common theme, and they realize we knew nothing about these things. They're not hard concepts, but they just didn't get any of the science or explanation that went with it. And I love your analogy of the spokes. And so in longevity, a lot of times we use the car analogy, right?
Oh, tell me about that.
Right, of things wear out. Well, I borrowed kind of off of your theme a little bit on this one, because I've got I kind of had the pillars thing in a pentagon. I thought, hang on a sec, I like Saray's view of that. And I put it, because as you alluded to, it's all about balance,
Yes.
right? It's
Of course.
life is about balance and understanding. Like, you may think you're in balance, but if you don't understand what balance is, then you're living some other reality. And so you go out on a long journey. Well, who's going to start out on a long journey with with wheels that they know are out of balance and need to get work?
Yes.
So would we do that to our car? No. So why would we do it to our body?
Exactly.
So yeah, it's just becoming a little bit more aware. Let me ask you about. I wrote something about this the other day, and I know that you talked to Dr. Tom Rafai about it, and it's just a great one. Fiber, right? We don't want to get into any of the details about diet and all the right, which is the right diet. But if there's one thing everybody, certainly in lifestyle medicine, agrees on, is the role of fiber.
We need more fiber in our diet. It's so important. Everyone, it's funny because everyone, when it comes to diet, everyone's sort of fixed on protein. Am I getting enough protein? And I think what we really need to move toward is don't worry, you're going to get enough protein. Let's focus on the fiber, because most Americans are not consuming enough fiber. They're probably consuming somewhere between 13 and 15 grams of fiber, and we probably need 25 to 30 grams of fiber. This is where the magic is, and we've learned that why is fiber so important? Because when you consume a diet rich in fiber, it is modifying your microbiome, this organization of organisms in our gut that are so incredibly important. And when we have this good population sort of flourish, these good bugs produce these important compounds, these short chain fatty acids like butyrate, that then speak to our immune system and play a role in creating a healthy cellular environment. So fiber is, I think, should be the word of the decade. If we can relay that message. And guess what? The only place you're going to get fiber is in plants. So we need to consume more and more plants. and circle and keep that plate of ours colorful, and full of these plant fiber rich foods, because they are so important in creating that healthy environment in our gut.
Yeah, and I'll tell you my own experience having kind of, I've always been adventuresome in food. If I'm looking at the menu in a restaurant, I'm going to gravitate to the thing I don't know what it is and I've never had it.
Oh, that's great.
And
I
give
love
me a
that.
reason not that. I just always have been like that. And I would tell, so even though, routine was never my thing, I would tell you that I have, as I over the years learned more and more about kind of the plant options. And of course, it's been an explosion of options now.
Yes.
And there's another myth out there I think people have, is that you're trying to take away my favorite things, whatever they are. And I would tell you again, that is one of the biggest myths going. There is this huge, expansive plethora of options
Yes.
of all the different ways to have food that goes exactly to the things that they thought that that they were fixating on. You're not giving up at all, like barbecued whatever.
Yes.
Like barbecued chicken leg, the chicken is or whatever, it's there primarily to hold the sugar or whatever that you want. It doesn't have to be have a bone in the middle of it.
Exactly.
Yeah, there's any number of things that that create new options, which I think is so great. So one last one, if you could just bring me back to kind of, I think this one was again in the book you talk, and I may have the pronunciation wrong. Is it the Karelian Project in Finland?
North Karelia. Yeah.
North Karelia. Yeah. So if you want to, I found that really impactful.
Yeah.
Kind of.
So it's really an extraordinary story. North Karelia, Finland had one of the highest rates of heart disease in the 1960s, and it's really an amazing story because it represents a public health win, where you have a team that looked at the problem and realized that this excessive amount of heart disease was largely connected to behaviors. So it was post World War II smoking. It was increased in consumption of saturated fat and dairy products, and an absence of fiber-rich plant-based foods. And so what they do, they brought together a team that disseminated messages into the community, and they had housewives have, you know, in their homes invite 4 or 5 women and talk about creating healthier options. They talked to the federal government. I thought this was really a wonderful solution to a problem. Apparently in Finland, they have this sausage that is, very much part of their culture, beloved, this pork sausage. So what did they do? They decided to replace some of the filler with mushroom in the sausage. So they made small, and the community, people still enjoyed the sausage. They didn't realize that it was just a little bit healthier. There was a lot of communication about smoking cessation, about physical activity, about bringing, they grow berries in Finland during the spring and summer months, but then the rest of the year, there was no access to these beautiful berries. So what did they do? They encouraged farmers to grow more berries, and then they froze them. So in the winter months, they would be available. And little by little, they started to create change in culture and in the environment. And what happened? They were able to reduce heart disease by 70+% in 25 years. I mean, it's such a remarkable story and such a roadmap for us to follow. And it was just really teaching members in the community and then having them go out and disperse this message in small settings, libraries, homes, communities, schools, hospitals, just sharing this message and disseminating it. And they created an extraordinary happy ending.
Yeah, I found, I mean, as a researcher, I just found that so compelling because that's real life. Like we can talk about things in the lab and we can do in vivo testing on small groups, but boy, that's a whole population. There is, yeah, it's super powerful. Here's the book. I highly encourage you to take a look at it. It's just filled with all sorts of information. We've got food information, which we didn't get into, or all sorts of things. It's Saray, it has been a pleasure to speak with you today. I thank you for the great work you have been doing and are continuing to do, and we appreciate your guidance along the way here today.
Thank you so much, Scott. It was a great pleasure to chat with you today.
Great. Thank you. Take care.